Okay, so gratitude as a positive psychological intervention. Just an introduction. So, gratitude can be viewed as a positive social emotion, and it's defined as the acknowledgement of receiving something of value from someone else. And this definition emphasizes how the positive outcome of experiencing gratitude must be external. So, essentially, you can't really experience gratitude from within yourself or for yourself. You can't be grateful within this definition. So gratitude interventions are designed to improve aspects of well-being like positive affect, happiness, and life satisfaction. So which aspects of well-being does it target specifically? So research of gratitude interventions have exhibited a range of benefits for social, emotional, and psychological aspects of well-being, such as more frequent physical activity, higher levels of positive emotions, greater optimism, at least in the short term, increased alertness or enthusiasm, greater chance of being supportive and helpful to others, and greater life satisfaction. So, a myriad of populations have been researched in relation to gratitude interventions, including university students, lots of different age groups, children, university age, and then adults as well, and as well as different genders, clinical and non-clinical populations, mentally and physically ill populations, and then Western and non-Western populations have been researched, although most of that has taken place in Western populations. So that's kind of what this will be focusing on today. Um, just a continued introduction, more about gratitude as it is a social emotion. So, there's a kind of a difference. There's two different types of gratitude. There's state gratitude and then there's trait gratitude. So, gratitude involves a feeling, emotion, or mood. And an example of that is being complimented or given a gift causes a state of gratitude, and that's a temporary state. And then in contrast to that is trait gratitude, which is a virtue or a long-term disposition. And the trait gratitude is stable. Um, so it hangs around. It's kind of a virtue. It's a part of a person. And it's used even when life is difficult. And that's why it's especially useful because it can be employed as a kind of a coping resource when things are tough. Um, and it's also important to note that state gratitude, when practiced, can turn into trait gratitude. And that's how a lot of these um, interventions function, or this is a way of explaining how they function. Then there's three mechanisms of gratitude itself. And so that's a moral barometer, a moral motive function, and a moral reinforcer function. So the moral barometer, essentially, we experience gratitude towards someone from a moral good that they've enacted to us. Then you have the moral motive function. So we are then from their action, we're motivated to act pro-socially, or from our gratitude, we're motivated to act pro-socially to not just them, but people around us in general. And then lastly, there's the moral reinforcer function. So the agent or benefactor, they are reinforced to act morally through our pro-social behavior. Target audience. So I chose first year university students as my target audience, as many students face stresses throughout their education, especially in their first year of university. So these stresses can be both internal and external and can include challenges like heightened workload, deadlines, limited time away from school, and other factors like family circumstances, relationship troubles, illness and injuries. They can all be significant stresses for students, which can impact their well-being. So research shows that university students, especially those in their first semester of their first year, experienced increased levels of strain. And that's a big part of the reason why I chose this target audience. It's also important, as a side note, that this experience is shared between domestic and international students. So some critical analysis of the body of evidence around gratitude as a positive psychological intervention. So, the body of research around gratitude interventions in general shows it has a range of positive impacts on well-being, such as increased positive affect, happiness, mood, and overall life satisfaction. But it could be that university-age students do not benefit from gratitude interventions as much as adults do. But this might be due to university students having different goals to adults. So, adults might be participating for the purpose of self-improvement, while university students may only be participating for academic credit. So obviously the adults, yeah, if that's true, are going to get more out of it than a college age student would. So the results kind of might be skewed in that way over multiple bodies of research, multiple experiments. And then additionally, there's limited evidence that there's evidence that gratitude practices do not have impact on other aspects of well-being, such as physical health, exercise, or sleep. So there's limited evidence that gratitude does actually have a significant impact on those aspects of well-being. So this is just a quick example. Uh, it's not a broad study. It's just one. It's not a broad meta-analysis, but it's just one study. So it's an example of gratitude interventions being used for university students, and it's by Utami and colleagues. That's a 2020 study on 16 university students, and they're not first-year students, but they were undergrads, and they were all completing their thesis. So it's not fully accurate, but they're still under high amounts of stress, which is like first-year undergrad students. So they used a quasi-experimental model that compared an untreated control group and an experimental group, which was administered gratitude cognitive behavioral therapy, or GCBT. So the intervention included a gratitude journal and gratitude letters, and it's based on GCBT, which is aimed at developing new abilities, understanding new themes, and strengthening the ability to cope in challenging transitional periods of life. So, sorry. The results showed that students which went through the GCBT showed significantly increased levels of gratitude and decreased levels of stress in their post-test and follow-up tests compared to their pre-test results, indicating that the gratitude intervention was effective in improving the students' well-being. And so, again, while this is just one small study, I think it's a good example of how gratitude practices can have a positive impact on students' stress levels and overall well-being, and not just in the short term, because there is that follow-up test which showed those positive results. So the strengths and weaknesses of the current set of evidence. So many studies compare gratitude interventions with opposing conditions when they might do better comparing gratitude interventions with neutral conditions. So essentially, an example, many randomized controlled trial studies compare an experimental group, which lists things they're grateful for throughout the week, with a control group that lists things that bother them throughout the week. Studies would do better to focus primarily on the relationship between gratitude and neutral groups, as these results tend to be more reflective of real-world context. That being said, there is value in comparing positive and gratitude interventions with their opposite, with the negatives, because that can kind of show the it can kind of show show the results to a greater extent, making it more clear. And it can also show how gratitude works as a spectrum. So the current array of research around the efficacy of gratitude interventions for university students, or at least university-aged people, is extensive. And gratitude interventions have been widely examined, but there are some shortcomings in that research is frequently not targeted to specifically first-year university students. So while a range of studies and meta-analyses discuss university-aged people or people in university, the target audience that I chose is ultimately very specific. And despite it being so specific, the amount of research that shows similar results for this age group and for people in university kind of implies that the results may be generalized accurately to first-year students. And again, studies have taken place in Western and non-Western societies, but most have been in Western cultures. So gratitude, comparing gratitude to other positive psychological interventions and multi-component psychological interventions. So gratitude versus mindfulness interventions. So it's important to know, so both of them are effective, but gratitude has been seen, some of the results have shown that gratitude is better for stress, while mindfulness is better for depression, or better for reducing depression and increasing happiness, although those results might be inaccurate due to a high attrition rate from some of those studies there. And then you have multi-component PPIs. So they're comprehensive, longer duration interventions. They're shown to be most effective for well-being across different populations. Future studies may consider exploring how gratitude interventions can be used in conjunction with other PPIs like mindfulness interventions as part of multi-component interventions, and also more research on specifically university students and specifically first-year university students. And so these multi-component PPIs, they tend to be more effective in the long term compared to short-term interventions. And there's the references. Thanks for listening.